Hi, my name is Wes Wright. I'm the Chief Technology Officer at Imprivata. Before I came to Imprivata, which was only a couple years ago, I was CTO out at Sutter Health and then CIO and CTO at a bunch of different other locations. Our customers during the COVID pandemic, our customers have been just fantastic with coming up with new ways to use our technology. Number one, and then two, their willingness to share it with the rest of the healthcare organizations out there. A couple of the use cases that I really like. Two of them, of course, come from our ground control acquisition, and that's the use of the iOS devices. Uh, Two uses. One, the use of the iOS device for the COVID patient to be able to talk to their family and friends who, of course, couldn't visit them in the hospital. And the second one, which I think is really clever, is that since that COVID patient does have an iDevice, a tablet, or something like that, then the physician uses another iDevice and essentially stands in the hall and does a telehealth, quote unquote, telehealth visit. We're starting to call it an inpatient telehealth visit with that COVID patient, and that keeps that provider from having to enter the room, which then in turn keeps them from having to use a set of personal protective equipment or PPE. And then one on the one side side that I really kind of like, and it's kind of geeky, I guess, is the way that we can use the reverse proxy so that people can now reset their passwords at home. It's we never used to want to do that because you don't really want people to reset their domain passwords and stuff when they're not on-prem. But because of COVID, we've loosened that restriction up a bit. And I think it's kind of cool because as people were going home and trying to work from remote, Imprivata was kind of a victim of our own success in that they didn't know what their passwords were for any of these applications. And so the help desk were getting inundated with password reset requests. And so we explained to people, it had already always been built into the product, but we put out there how you could set that up so that your help desk wouldn't get swamped. Yeah, there's some things that have happened because of COVID that I think are really going to stick around. I mean, the obvious, fall off the chair, easy, obvious answer is virtual care. We have essentially over the last 2.5, 3 months, we've proven the efficacy of virtual care. So I think we're going to see a lot of virtual care stick around. I don't think we'll see it to the degree we are now, and really, actually, it all mostly depends on how long CMS is going to fund virtual care at the same rate as in-person care. If that goes for another year or so, well, then we've built a habit, and I think we'll see a lot more virtual care stick around. But if they stop funding in the next month or two, say October, when the new fiscal year starts, I don't think we've been doing it long enough to build that habit, and I think we'll see the virtual health instances drop significantly, but nowhere close to those low levels that we had before. So yeah, virtual care is something that's going to stick around forever. So, it's not only the healthcare provider organizations that have had to make a dramatic pivot in this COVID environment, but we at Imprivata had to pivot ourselves. We were used to going on site with our customers and helping with implementations and installing our products there in person. And our professional services group, led by Doug Kyra, just did a sensational job of pivoting and being able to do all of those installation services from somewhere else, so virtually. So we didn't have to send folks into a COVID environment, one, and two, the health delivery organizations didn't want us there. So Doug's group pivoting to make those implementations and installs almost all virtual was an incredible task, and I applaud him for that. And oh, by the way, also the training. Well, that used to be held at Imprivata's headquarters. Well, you can't do that anymore. So we took that that team took that virtual as well. So making that really fast pivot to being able to make all the implementation and the training virtual, I think that says volumes about the folks that we have at Imprivata. The last words of wisdom, take them for what you pay for them, which is zero. But it's not a piece of technical advice or anything like that. But as we're all distanced from each other, when we do get to come back together, my wisdom for navigating these uncharted waters is to just be nice, be kind to one another as we get back together, and I think we'll see productivity increase and more smiles than frowns.